A new report by Princeton University, perhaps the largest contact tracing study so far, has found that children are key to the spread of the coronavirus. What's more, a study of 500,000 people in India exposed to COVID suggests the virus's spread is driven by only a small percentage of those infected. So let's bring you some of the key points of the study. 71% of infected individuals did not infect any of their contacts, while a mere 8% of infected individuals accounted for 60% of new infections. Coronavirus-related deaths in India occurred on average 6 days after hospitalization, compared to an average of 13 days in the United States. The chances of a person with coronavirus, regardless of their age, passing it on to a close contact ranged from 2.6% in the community to 9% in the household. Children and young adults were much more likely to contract coronavirus from people their own age. The overall probability of catching coronavirus ranged from 4.7% for low-risk contacts up to 10.7% for high-risk contacts. Well, joining us now, Ramanan Laxminarayanan, lead researcher of this report. He's also Director and Senior Fellow of the Center for Disease Dynamics, Economics and Policy. Thanks very much, Ramanan, for being with us. Would you therefore call 8% of infected individuals super spreaders?
So we have to understand that super spreading is not what we imagine super spreading to be, which is one person going into a wedding or a religious gathering and spreading to 50 people. Super spreading just means that some people, a very small number, maybe about 8 to 10% of people, are capable of transmitting the virus to far more people than other people are. In fact, those 8 people may only transmit to 5 or 6 other people, but they constitute super spreading. So super spreading doesn't have to be many people that they spread to, just a few. But the thing to remember is that most people don't spread to anyone at all.
Why do some people spread more than others?
Well, we don't really know the answer to that. We just observe this for many diseases, but nowhere is it more sharp than it was for SARS-1 and for the coronavirus. So most of the diseases are not necessarily what you'd call these super spreading diseases. And it could be a function of host factors, which is individuals are more likely to shed virus, therefore they pass it on to more people. It's also possible that some people happen to be in contact with far more people than other people are. So both of these contribute to super spreading.
So it doesn't have anything to do with the viral load of an individual?
It could do with the viral load of the individual. We just don't know the answer to this. So these are the things we're trying to understand, because we've noted the same phenomenon whether in Korea or China or in India. We're seeing the same patterns. But obviously the Indian study is by far the largest in the world. So it adds a lot more weight to this idea of super spreading.
And 500,000 people in India is what your study looked at. How did you actually manage to get all this data? That must have been an incredibly challenging process.
The data actually come from contact tracing that was done by the states of Tamil Nadu and Andhra Pradesh. They started doing this from the very early days of the epidemic. They contact traced something like 7.5 people, an average 7 people for every infected person. So we had data on 85,000 index cases and 3 million people who were identified as contacts, of which we had pretty reliable data on about 575,000. This is not just the largest contact tracing study of COVID in the world. This may well be the largest contact tracing study of any infectious disease in the world, but it was made possible because of tens of thousands of health workers in these states, the cooperation of the bureaucrats in the states who wanted to understand what was going on. So it was a perfect partnership between academia and government that made the study possible.
Now, the coronavirus-related deaths in India on average occur 6 days after hospitalization, compared to an average of 13 days in a country like the United States. Why is that the case?
2 reasons. One is that we probably are identifying cases a little later here than perhaps in the US. We don't have real proof of that, but that's one possibility. The other possibility, which is probably a stronger possibility, is that healthcare is much stronger in the US. They have better hospitals, and therefore they probably have the ability to keep patients alive for much longer. A third reason could be that there are systematic differences in just underlying immunity or ability of people to sort of fight the virus because of nutrition or comorbidities or respiratory illness and so forth, which might make Indians more prone to the disease to die sooner than people in the US do.
There have been certain beliefs about children and young adults in the past, but that's changing. How are children and those who are young more likely to contract coronavirus from people their own age? Why would they get it from people their own age?
So first of all, prior to this study, we didn't have a whole lot of data on the role that children play in coronavirus transmission. The early studies out of China didn't have a lot to say on children because China doesn't have that many children. Now, in our study, we found that children are, especially over the age of 10, are as likely to contract coronavirus and to pass it on as any other age group. But they tend to pass it on mostly to people of their own age group because every age group tends to pass on the disease more to people of their own age group. So this pattern is the same whether you're talking about young adults or the elderly, even the above 75 folks all transmit to other people who are above 75. That's because people tend to spend more time with people of their own age group. We thought this would be different for India because we have multi-generational families, and so we thought there might be a lot of cross-age transmission. There is cross-age transmission, but not as much as there is same-age transmission.
Ramanan, one statistic which I think people need to be careful about because it could be misleading, not the statistic itself, but how people react to it, is that the overall probability of catching coronavirus range from 4.7% for low-risk contacts to 10.7% for high-risk contacts. Therefore, somebody seeing this might say, oh, look, there's only a 4.7% chance that, I would contract it from someone who may have got the virus, would tempt them perhaps not to maintain social distancing. But I think the essential point here is that we need to be careful, and 4.7% is still a very significant number. It goes up to 10.7%.
I think the thing to focus on is that in our study, as well as from other government statistics, the mortality rate, the case fatality rate is 2% or roughly that. Now, that's a 1 in 50 chance of dying of something. I don't know about you, but I don't want a 1 in 50 chance of dying of anything, right? So you're talking about a 4% chance of contracting a disease, which after you get it, you have a 1 in 50 chance of dying. And particularly in India, where that risk of dying between the age of 40 to 70 is higher in India than in any comparable country that we looked at, Brazil, China, Italy, or the United States. India's case fatality ratios in those age groups are much higher. So I think people should look at that and say, do I really want to contract a disease where there is then, a high chance of dying or 1 in 50 chance of dying, which is unacceptably high. We don't face that kind of risk with crossing the road or getting on a plane or nearly anything that we do with such a high risk of dying. So I think that that's the perspective to take here. That's one. The second is that it's not just about ourselves. Every time we wear a mask or we socially distance, we're protecting the elderly people in our family. We're protecting anyone, literally above the age of 40, to be honest. So that's, many of us ourselves. So I think it's about protecting the other people in our country and our families and not just about ourselves.
All right, Ramanan Laxminarayanan, pleasure to speak to you, and thank you for sharing these absolutely startling facts. Thank you very much indeed.
Thanks for having me.